Step 57, starting frozen embryo transfer cycle. So once you have spoken to your fertility specialist and created treatment plan for frozen cycle, once you have got instructions from the nurses on how to start the cycle, you go through your own checklist. You make sure that you're ready to start from physical health point of view, from emotional health point of view, and you sorted out your work commitments, and your partner is ready to start. Then you go through your personal checklist. You make sure that your consents are up to date, your screen tests are up to date, then your finances sorted out, and you got prescriptions for the drugs or collected the drugs, and you got your test forms and gone through the instruction for your frozen embryo transfer cycle. Then you will wait for period. Frozen embryo transfer cycle should be started with menstrual period. That period can be natural menstrual period or can be induced using pill. Why we should start during menstrual period is there are three reasons. One is to make sure that you are not pregnant when you are using frozen embryo transfer cycle drugs. Second is your hormone levels on the baseline to make sure your endometrium is not activated already. So also to make sure that you got rid of old endometrial lining and you're going to build new lining for implantation. Menstrual period point of view, you need to ensure that this menstrual period from uterus point of view, which is proven by having menstrual period during expected time. If you did a fresh cycle and if you're doing back-to-back frozen cycle, on the back of fresh cycle your menstrual period may come a little bit early. That's normal. Otherwise you should have a menstrual period or bleeding during expected time. And also your baseline ovarian hormones and pituitary hormones should show actually that's menstrual period. That's called baseline hormone profile. For that you check FSH, LH, estradiol, progesterone, and HCG. So HCG is pregnancy test hormone, which again confirms that this is actually your menstrual period and you are not pregnant when you are starting frozen embryo transfer cycle. Then you inform the clinic that your period started and you're ready to start frozen cycle, and your clinic goes through, nurses or admin or coordinator will go through your checklist. In checklist they again check if your consents are up to date, if your screen tests are up to date, and the finances are sorted, and you received your drugs, and you had a full instruction for frozen cycle. It is very important to know how you can initiate the cycle. In some clinics, especially if they use natural menstrual cycle before starting frozen cycle, patients need to inform the clinic that their period started and they're ready to start frozen cycle. In other clinics, frozen cycles can be programmed using pill. After 28 days of pill, you have a menstrual period, then clinic may contact you to initiate the cycle. Starting frozen cycle seamlessly is very important to have a successful frozen embryo transfer cycle.